Hi everyone, today I am giving you information on the topic myopia. So let's move to its description. Myopia or short-sightedness is a type of refractive error in which the parallel rays of light are coming from infinity, focused at the point in front of the retina when the accommodation is at rest. So let's see, myopia is also known as a short-sightedness or the nearsightedness because in case of myopia we are able to see the nearby objects clearly. That is why it is known as nearsightedness or short-sightedness. Okay, so here the parallel rays of light are coming from the infinity and they will focus at the point which is in front of the retina. As we all know that this one is the retina and the parallel rays of light focused at the point which is in front of the retina. So this condition is known as myopia, due to which we are not be able to see things clearly. Next one, here uh, they will focus at the point in front of the retina when the accommodation is at rest. So we all know that the accommodation is done by the lens, which is supported by ciliary muscles as well as the genital fibers. So when the accommodation is at rest, parallel rays of light are coming from infinity. They are coming from a lot of far away and they will focus at the point which is in front of the retina. So this condition is known as myopia. It is also known as short-sightedness or the nearsightedness. Next one, etiological classification. Now in this we will discuss about the axial myopia, curvature myopia, positional myopia, index myopia, and the myopia due to excessive accommodation. Let's see one by one. First one is axial myopia. Axial myopia results from increase in the anterior posterior length of the eyeball and it is the commonest form. Now in this case the anterior posterior means from the anterior to posterior. This one is the length of the eyeball and this one is the normal, and in this case the eyeball gets elongated. Due to the elongated eyeball, the rays of light will focus at this point. Due to its elongation, the retina will be behind back at that point where the image is formed. So due to which the image is not formed on the retina because the retina is somewhere back. This is known as axial myopia and it is one of the most commonest form. Due to increase in the length of the eyeball, the rays of light cannot focus on the retina. This is axial myopia. Next one, curvature myopia. Now in case of curvature myopia, the curvature of the cornea or the lens get increase. So let's see, this one is the cornea. Sometimes the curvature of the cornea becomes more curved. When the cornea becomes more curved, due to its curved nature, the rays of light will not focus on the retina, and sometimes the curvature of the lens becomes increases or becomes changed, due to which the image cannot be form on the retina. So these two again are the reasons of curvature myopia. Curvature gets changed due to the curved nature of the cornea as well as due to the curved nature of the lens, which gives birth to the curvature myopia. Next one, positional myopia. Positional myopia is produced by anterior placement of the crystalline lens in the eye. Now, sometimes the crystalline lens get dislocate inside the eye. Okay, so this one is the dislocation of the lens. As we have seen, the proper location of the lens is here. Okay, so the lens become dislocated. Due to the dislocation of the lens, it leads to the positional myopia because there is a displacement of the crystalline lens takes place. Okay, this is known as positional myopia. Due to the change in position of the crystalline lens, the lens get dislocated and due to which there is a positional myopia. Next one, index myopia. In case of index myopia, it results from increase in the refractive index of the lens. Now as we all know that this is the lens and the lens becomes cataractous due to the development of the cataract inside the lens, which leads to change in the refractive index of the crystalline lens. When the refractive index of the crystalline lens, then it leads to more myopic patient. Okay, so this is the index myopia. Next one, myopia due to excessive accommodation. Sometimes it occurs in the patient with the spasm of accommodation. Those patients, sometimes a patient do excessive accommodation, they will accommodate excessive, contract or relax their accommodation becomes very excessive, due to which the myopia develops. Okay, and the accommodation is done by the ciliary muscles, which is followed by the zonular fibers, and lens become contract as well as relaxed due to the both of them, ciliary muscles as well as zonular fibers, which get attached to the lens. Next one, reading of myopia. Myopia is divided into three parts. First one is the low myopia, next one is the moderate myopia, and third one is the high myopia. In case of low myopia, when the error is lesser than or equals to 3 diopters. When the myopia is less than 3 diopters or equals to 3 diopters, which is 2.5, 2.25, 1.5, this is the low myopia. Next one is moderate myopia. Moderate myopia is when the error is between minus 3 diopters to the minus 6 diopters, that is moderate myopia. Next one is high myopia, when the error is greater than or equals to minus 6 diopters, that is the high myopia. Thanks for your patience listening.